let's talk about some movement disorders. Some terms that are used to refer to abnormal movement include dyskinesia, that's the impairment of voluntary movement, or dystonia, which refers to muscle spasms, which might lead to abnormal posture. And then there's akinesia, which is the total loss of voluntary movement. Earlier this semester, we talked about Parkinson's disease in relation to L-DOPA, and also in relation to deep brain stimulation. But let's talk more about Parkinson's disease and how the basal ganglia controls movement. Parkinson's disease is caused by the degeneration of dopamine-producing neurons in an area of the basal ganglia called the substantia nigra. By the time a person is beginning to show the first symptoms of Parkinson's disease, only 30% of the dopamine-producing neurons in that region of the brain is left, suggesting that we are all carrying around extra dopamine neurons in that area. We've already talked about how Michael J. Fox is one of the most prominent individuals with Parkinson's disease, and he was diagnosed at the young age of 29. His foundation has raised a lot of money to conduct research on the topic of Parkinson's disease, but no cure has yet been found. One of the conditions that's most easily confused with Parkinson's disease in the earliest stages is essential tremor. It is a nervous system disorder that causes involuntary movement, rhythmic shaking, usually the hands, but it can affect other parts of the body, including the head. Typically, it affects people 40 years of age or older, and it does worsen over time. 50% of the cases may be inherited, but there is really no known mechanism that causes it, so more research is needed. There's a link on Canvas that describes a first-person account of living with essential tremor. It is quite the aggravating disease. It begins generally on one side of the body and worse on that than the other. But it worsens when you try to move. So as you try to move your hands, the hands shake more. This is actually different from Parkinson's disease. You might have a shaking of the head that looks like a yes, yes shaking or a no, no nodding of the head. When a person's aggravated by stress or fatigue or having a lot of caffeine or changing temperatures, the shaking may worsen. So how do you know if the shaking is due to Parkinson's disease in the early stages or to essential tremor? This would be kind of like a differential diagnosis that you might see on a medical TV show. So if the tremors worsen when you move, you might have essential tremor, because with Parkinson's disease you get the tremors when the body is not moving. If the arms are down to the side or the hands are in the lap, you would still get tremoring with Parkinson's disease. With essential tremor, you're less likely to get it when the hands are not moving. And the parts of the body can also be helpful. Parkinson's disease typically affects the hands, legs, chin, and other parts of the body, but essential tremor most often affects the head, hands, and voice. Our third movement disorder for today is Huntington's disease, or Huntington's chorea. It's an inherited disorder that causes progressive problems controlling movements, but also comes with cognitive impairment that progresses all the way to dementia. The symptoms emerge between the ages of 30 and 50, but you can have kids who acquire a very aggressive form. It's a very rare condition affecting 1 in about 10,000 to 20,000 people. We now know that the genetic mutation is occurring on chromosome 4, affecting the HTT gene. The part of the basal ganglia that degenerates during the course of Huntington's disease is the striatum, here circled in blue, and the striatum contains subareas, the caudate nucleus and the putamen. Huntington's disease is well understood in terms of inheritance. 90% of the cases have an autosomal dominant pattern of inheritance. So if a person's parent, one of the parents has the gene, there's a 50% chance that the child will have the genetic mutation. And this is one of the rare mutations that has a 100% likelihood of causing the disease if you inherit the gene. So if you take the genetic test and you have the genetic mutation, that means that in your lifetime you will get Huntington's disease. So it's a very discouraging, dreadful diagnosis to get. 10% of cases of Huntington's disease appear to occur spontaneously, so the spontaneous mutation occurs. And that means that there is no prior ancestor that's had the gene and passed it down to you, but something in your life experience led to the genetic mutation occurring. One of the most well-known cases of Huntington's disease was that of Woody Guthrie, an Oklahoman who was the well-known folk singer in the 20th century. He died in 1967, and his family today still raise funds and talk about how Huntington's disease has affected their family. When he was initially diagnosed, it had come after many years of instances in which he was seen to be walking, stumbling, falling down, slurring words, and people believed he just had a severe alcohol problem, but it was most likely the first stages of the disease affecting his ability to control his movements. For people today, some of the early signs of Huntington's disease would be unexplained falls, just falling down a lot. Woody Guthrie inherited Huntington's disease from his mother, who died in an institution when he was just 14 years old. She had become ill and actually set fire to the house, but no one really knew why she was ill. If one has ataxia, one might also have trouble coordinating their movements and appear to be drunk, slurring speech, stumbling, falling, and having a lack of coordination. Often this is caused by damage to the cerebellum. Here you see the cerebellum in the image. The cerebellum, we know now, controls the smoothness of movements. Because it can detect and eliminate errors when the movements are being executed, it causes our movements to seem very graceful. An inherited form of ataxia is Friedreich's ataxia, which causes poor coordination, gait problems, muscle weakness, even vision and hearing problems. There can also be curvature of the spine, heart disease, and diabetes. Unlike Parkinson's and Huntington's disease, there are no known cognitive problems that occur. It is caused by the degeneration of sensory neurons. People with Friedreich's ataxia have a problem with their FXN gene on chromosome 9, and it has an autosomal recessive pattern of inheritance, meaning that neither of your parents may have Friedreich's ataxia, but you could inherit the recessive gene from both of them and then end up with the disorder. It's a rare disorder affecting 1 in 50,000 people. Some movement disorders are autoimmune, such as myasthenia gravis. It involves the weakness of skeletal muscles that worsen after periods of activity and improve after rest. So it's affecting many muscles throughout the body. It affects men and women of all ages and all ethnic groups. Guillain-Barré syndrome is another autoimmune movement disorder. That's where your body's immune system begins to attack the peripheral nervous system. The symptoms can vary from mild to severe, and some people actually pass away from the disease. But for other people, they will have the syndrome but recover. The symptoms include difficulty with eye muscles and vision, difficulty swallowing, speaking, or chewing, difficulty with movement, abnormal heart rate and blood pressure, problems with digestion and bladder control, and that pins and needles sensation in their hands and feet. Our last movement disorder is Tourette syndrome, which is a complex disorder that starts in childhood. It involves repetitive movements or tics, which can include unwanted sounds, such as clearing the throat repeatedly and also cursing in an inappropriate way. There could be uncontrollable eye blinking, shrugging of the shoulders, touching objects, etc. The rate of Tourette syndrome in adults has been difficult to accomplish, so most of the stats are based on its occurrence in children. It affects about 1 in 160 children, but there may be an underdiagnosis with as many as 50% of the cases being missed. It does appear to affect all races and ethnic groups and ages. It's about 3 to 4 times more common in boys than girls, and genetic studies have found a link between the genetics for Tourette syndrome and obsessive-compulsive disorder. Some, but not all, people with Tourette syndrome will have coprolalia, which is the uncontrollable outbursts of swear words or profanity or even insults. In some cases, a person with Tourette's may also have echolalia, which is the mere repeating of something that others say, but in a conversation it can come off as maybe even sarcastic or offensive, so people with Tourette syndrome with echolalia would feel embarrassed by not being able to control that. That's all for now.